Our pets can experience a number of medical problems just like people. Finding the right treatment can really make a difference. This morning, Holly is at VCA Veterinary Referral Associates in Gaithersburg, Maryland, learning about state-of-the-art technology used in pet rehabilitation. Holly, this has been fascinating.
It really has been fascinating, and I have a feeling that snowboarding possum might need the doctor that I'm standing next to at some point, because he's an orthopedic surgeon. This is Dr. Matthew Keats, and he is one of the 40 doctors they have here, more than 100 employees at this amazing facility, and you really do pretty much treat everything.
Pretty much everything. The bulk is dogs and cats, but we have an exotics department that treats chinchillas and birds and rabbits.
I heard baby hedgehogs were born here.
Hedgehogs, chickens.
Super gliders have been here.
Sugar gliders, yeah.
Sugar gliders, super gliders. I've called them everything except sugar gliders. Sugar sliders, sugar... They're little marsupials. We'll just leave it at that, right? But you're right. The bulk is dogs. And so right now we wanted to talk a little bit about the orthopedic side of things. So tell me what's going on here.
So we have our friend Bella over here that's about 6 months post-op knee surgery. She had a cruciate ligament injury, like our ACL. Very, very common adult dog orthopedic injury, probably the most common thing that we see on a day-to-day basis. She had surgery in August. We have radiographs over here that on the left side is her pre-surgical films, on the right side are her post-surgical films. And in dogs, the way we treat, especially in these large active dogs, are procedures that make the knee stable in the absence of an intact ligament, because they have such high demands on the ligament that recreating them does not work great, especially in this size and activity dog. And that is called a TPLO, or a tibial plateau leveling osteotomy, one of several surgeries that have that basic premise and how they work.
You know, and what's amazing about this is not only do we have the best of the best here available for our pets, but we were talking to, you know, one of the other doctors, and he said there are doctors around the world, like radiologists around the world, that have access that can read these and get information back to you. So you also have resources that you can access outside of these walls.
Absolutely, especially with the internet. A lot of our radiographs and some of our other imaging studies are read off-site. We have a radiologist on site, but off-site reading, and sometimes even just the ability to contact another surgeon, or if you have a case that's really bizarre and you want to talk to another surgeon and you want to do that, it's very easy nowadays to bring other people in.
Well, I'm wondering, are there certain dogs that are more suited to rehab than others? I mean, how do you know if your dog's really going to get the most out of the services you offer here?
I think the dogs that really have, you know, we're going to be able to return the dogs, or our goal is to return the dogs to function as soon as possible. It's basic. All orthopedic surgery is early return to function, and that increases their speeds their recovery and improves their limb health and the other limb health. So all dogs pretty much benefit from it. We have some dogs that really can't do it. Aggressive dogs tend to be one that the rehab technicians just can't work with. Dogs that are well motivated. Bella's pretty, she's food motivated a little bit, like, and so was the Cocker Spaniel you guys showed earlier with the back problems, is pretty food motivated, but dogs that are also, Bella's very engaging and wants to please, so she wants to learn new things. She really gets a kick out of learning how to do some of these activities. And so she really is a pretty easy dog to work with. Some dogs are not so motivated. Some dogs are stubborn. The rehab technicians.
Just like people.
Absolutely. Right? Dogs that are like police dogs, dogs that have a lot of drive, or working dogs are really good because they're used to taking commands, they're used to learning new tasks, and they're definitely very easy for the technicians, and they really get a lot out of it.
Well, let's check in with Renee. And so, Renee, there we have Bella up on the ball there, and you can see her shaking a little bit, so kind of give us an update of how things are going.
Yeah, so this is a really good strengthening tool, and obviously, like you said, you can see her muscles shaking, so we're engaging them. So I'm slightly, actually gently rubbing her, you know, bouncing her up and down, and that actually stimulates that weight shift and that engages the muscle. So it's a really good strengthening tool. And early post-op, we used it to encourage her to put more weight on the surgical limb early, because that's very, very important to rebuild the muscle and get her back to normal condition.
Now, when you guys went into the field of veterinary medicine, did you know that you were going to become so specialized?
No, I didn't really know. Personally, I didn't know tons about specialty medicine. I kind of was one of those people that got the idea that it's really neat to be able to do a little bit of everything. When I was in school, I realized I want to be really good at something specifically, and that way I can have a narrower focus and sort of be an expert in something. And that's when I decided I wanted to become a surgeon. There are only about 1,200 surgeons that are board certified by the American College of Veterinary Surgeons, so there's just not that many of us out there. So it's great to be able to do it. And the job, if you're a pet lover, you get to work with pets. You get to work with pet owners that really want to do the best they can do for their pet, and then you get to work with people that love pets also. All the technicians that work here love the job. So it's a win-win-win
for everybody.
You couldn't ask for a better job if you're a pet lover.
Absolutely. MyFoxDC.com is our website. We have a link to the VCA Veterinary Referral Associates, and we've talked about how special this is, but perhaps the most special thing is that it's in our area. So now you know about it, and it's here if you need it. Back to you, Allison.
All right. I hope that we never need it, though, Holly. Thank you. Good to know they're there. I am outside in the Fox lot.